See these things like this
Is that
pop
the little
up?
bar that makes?
That's one of them.
Oh, one of them.
Hopefully that won't come back. I don't know what that one was. You're like, oh, go. Oh. Welcome Zoom participants. Sorry about my going ons up here. We want to welcome you to today's program. We're happy to have you all. I just wanted to, make sure everyone's got their cell phones turned off or silenced, just out of respect for our instructor. And I wanted to point out, excuse me if you were in the room the last few times I have made these announcements, but in case you weren't, I always want to give everyone ample opportunity, just to tell you about a few upcoming classes we've got. On December 3rd, we've got the 60 Years of Charlie Brown Christmas Special by Larry Hess. If any of you have taken one of his music classes, you are, you know how wonderful those classes can be. And that's actually going to be done at the museum auditorium. So that information's in the catalog, but we'll also, Susan will point all that information out as we get a little bit closer. December 4th is A Journey into Ecology by Dr. Ron Williams and Shandis Whitehelms. And that is going to be a class about not only science, but it's going to be able to teach us what the giant salamander has to do with water conservation. And so it's going to be very interesting. Dr. Williams is a dynamic speaker, so if you haven't registered, I think that would be a great one for you to explore. And then on December 10th, the 3 women who helped build the Texas Panhandle. That one previously was scheduled in this classroom. That's the way it's written in the catalog. However, Susan worked her magic and found a different classroom venue at the Fiber Max. If any of you have ever been out there, it's ample room. So we've been able to open that class back up. It was previously sold out. So we're able to open that one back up. And if you haven't registered for that one, you might want to look into that one as well. And then the final class of the semester is the McPherson wine tasting. And that's like I said, the last class of the semester, but it's also a celebration class. So we've invited all of our instructors as a thank you, and then all of you who want to come out and be able to mingle with all of us and just kind of reminisce about the great semester that we've had. You'll want to check that out. So that'll be a lot of fun.
What was the date?
That one is December 11th. So I am thrilled to introduce you to today's instructor. When I first met Dr. Carla Daniele, I felt a little tongue-tied, but the first question that I had that I didn't ask her was, where do you buy your clothes? You can tell me later. But she is as brilliant as she is beautiful. And she is an assistant professor in the surgery department at Texas Tech Health Sciences Center. And she is an esteemed breast surgeon and serves as the director of the UMC Breast Center and Integrative Medicine, specializing in combining standard and integrative care to support recovery and long-time wellness. Dr. Daniele earned her medical degree and surgery residency at Texas Tech University Health Sciences Center, Lubbock. And then she went on to complete a breast surgery oncology fellowship at Allegheny General Hospital in Pittsburgh, Pennsylvania. Board certified by the American Board of Surgery. The expertise and care and compassion she brings every patient she treats is remarkable. Help me welcome Dr. Carla Daniele.
Believe it or not, a lot of the children's section sound very short.
Okay, well,
Not a big secret. We'll see how my coordination skills Sit close.
How good they are.
Go help with the screen.
Thank you. Well, thank you so much for having me here. It's an honor having every one of you on a lovely fall Friday with perfect weather. So I appreciate you spending some time with me. I'll try to keep it brief. At any point, if you have questions, if I'm going a little too technical, please stop me. I'm used to dealing with only oncology patients, so if I'm speaking a little bit out of place, please interrupt me, and I'm happy to re-explain anything I might have said that might have been a little out there. But before I get started, I don't know that we're working.
Can you guys hear her okay? Okay.
I don't think the little clicker is working.
Uh-oh.
Or this. There we go. So just click here.
Yeah, you might, let me try that again.
There we go.
Okay.
Might have been shaken, so, right. I'm gonna spend a little bit of time to explain my background and how I ended up finding my true calling. Before going to medical school, I had the idea of practicing in healthcare related something. I come from a family where both my parents are physicians, so medicine was a natural fit for me. That's what I grew up with. It felt the right fit. My mom was a family medicine doctor, and just picking up little conversations, table conversations early in my life inspired me to do something that was more treating the root of disease as opposed to treating disease. Numerous conversations that I recall my mom telling my dad about her patients, of patient so-and-so has been going through infertility. She just started a diet. She's lost so much weight. Now she's pregnant. And time after time, in my head, it always sounded like obesity was the key trigger of a lot of health-related problems. So when I embarked my journey into going to medical school, I wanted to cure the world of obesity. I wanted to make a difference and hopefully prevent disease. Well, I started my training, then my exposure to the different fields. And the more I learned, the more I trained, the more I realized that, we're not there yet. There is so much more that we have to do before we can tackle that and cure the world of obesity like I intended. I went through my different clinical rotations. Initially, I thought, well, maybe if I pursue family medicine, which is what my mom did, I can start making some key triggers and key changes to make a little bit of headway. Didn't fit in pretty well. A little impatient. I like immediate results. I tend to be a little bit on the bossier side, so family medicine was not for me. And I found surgery. Surgery was a much better fit for my personality. I'm always up and going. I'm very energetic. Penny can attest to that. But the one thing about surgery that didn't really fit with my personality was the fact that it was a one-time service thing. I'm a very nosy person. I like getting to know people. I like seeing people over and over and knowing your family, knowing what's going on. That's how I narrowed to choosing breast surgical oncology as my career path. So yes, it is a one-time surgery intervention, but I also get to follow my patients for a minimum of 5 years and some of them for life. So yes, I get to meet a lot of my patients through some of the darkest days that they'll have in their lifetime, but I also get to meet their families. I get to see them through this horrible journey and evolve with them to help them improve their health and go on and spread the word of things where it's that we have hope about treating the disease and preventing other conditions as well. Soon after joining UMC Cancer Center and Texas Tech, I remember having a conversation with the UMC Foundation. It was meant to be a 15-minute conversation, just welcoming me to the cancer center, letting me know what opportunities I had to contribute to their causes, what different causes they had. At that time, they had already started planning for the expansion of the new cancer center. And one of the ideas they had was opening and building a new integrative medicine program. So they just asked me, do you know what that is? Prior to 2022, I had never heard that terminology. integrative medicine. Said, no, tell me more about it. What exactly is that? They started giving me some examples. I'm like, oh, well, everything that you're describing, nutrition, weight management, symptom control, physical therapy, those are all things that I already recommend to my patients. I know all the data behind each of these specific elements of integrative medicine. I just didn't know there was a name to call all these different therapies. That 15-minute conversation to turn into an almost 2-hour long discussion about all these wonderful therapies that we should make standard of care. We should put a name, have a facility, and offer to every single patient. And luckily, just like I was describing earlier, if I had to pick a cancer diagnosis to have, it would be breast cancer, because we're so good at treating that most of our patients transform into survivors for 5, 10, 20, 30 plus years. But because of that, because we're so good at treating breast cancer and other cancers, now we're having more time, more lag to deal with some of the ramifications of oncology care. Lymphedema, swelling, things that happen from surgery, things that are side effects of radiation, things that are side effects from chemotherapy. That's where integrative medicine comes into play to provide a better quality of life for survivors. But if we want to take it a step further, integrative medicine can also be a preventative alternative. We ideally, in best case scenario, we want to prevent cancer occurrence, period. So a lot of the things that I'll cover today are things that bring us overall better health and prevent our future risk of developing a cancer recurrence, but also risk of developing cancer, period. Sorry for that long introduction, but that's how I ended up being here today.
So and I was wondering exactly what integrative meant.
Yes,
So that's good. I was hoping you'd explain that.
good. And you are not alone. When I start talking to colleagues or patients about integrative medicine, that's the first thing everyone starts asking. What is integrative medicine? Well, it's a lot easier to describe what it isn't. Integrative medicine is not meant to be something to replace traditional cancer care. It's something meant to enhance the experience of traditional evidence-based cancer care. We do know there's potential side effects of all the treatments that we do. So what therapies can we use to mitigate some of the side effects, to make that journey a little bit more tolerable, a little bit more pleasant? But what can we offer you that by the end of this journey will put you in a state of health better than where you were before that cancer diagnosis? And that's my approach to every cancer patient that I treat, that I see, is, well, this cancer diagnosis can be used as a little wake-up call. That there's interventions, there's things we can do to get better to a state of health, better than what we were when we were first diagnosed. So it's a lot easier to explain integrative medicine with what it isn't. But again, there are also lots of different therapies that are included in integrative medicine, from psychosocial support, nutrition, weight management, all sorts of things that we're going to go through here today, just to give you an example of what those therapies are. But by no means is this a comprehensive list of additional therapies included in integrative medicine. I'm going to, I don't know how to get back.
I'm sorry.
Yes, there we go. So I picked my favorite therapies included in integrative medicine, and a lot of the ones that we are now offering at UMC Cancer Center, because these are the better studied therapies with the most promise in terms of health benefit, nutrition, exercise, supplements, weight management. And you'll hear a little later, we're going to spend a lot of time talking about nutrition and weight management. It's, in my opinion, that is the number one thing that we can do to improve our health and reduce our chances of not just future breast cancers or oncologic diagnoses, but overall chronic conditions. There's also therapies included in what we call manipulative or energetic therapies, acupuncture, massage therapy, aromatherapy, lymphedema, and then the mind and body therapies. That is, we're not neglecting the mind. I think that is an area in medicine that has been neglected for many decades. And the more research we do, the more we understand how important it is and how it can have implications to the outcomes of treatment and overall health development. So again, this is a list of all the things that we're going to cover in a lot more detail today, and I'll bore you with clinical trials and all sorts of minutia about why these are important. And so hopefully you get on board with me. Starting with my favorite topic, because again, this is how I found my true calling. I found a way where we can make a change little by little, one patient at a time, on saving the world from obesity, saving the world from disease, not just treating conditions, but preventing them. A lot of this information may be news to some of you, may be old news to the other half of you. Did y'all know that weight is now considered the second leading cause of preventable cancers next to smoking? Who knew that? Every time I give discussions about oncology, especially breast cancer, I get the most questions about that specifically. We've known this data for decades now. We're just not very good at getting that data out. So I'm bringing that to you. Changes in our metabolism can also contribute to further disease development and progression. We now look a lot at something called insulin resistance, where people are not necessarily diagnosed with diabetes, but they constantly live in this state of increased insulin or resistance that causes a lot of inflammation, and that's known to be a key contributor to developing breast cancer specifically, and why we're seeing a lot more of younger breast cancer development. That is not something that we're looking for. We're not very good at identifying it. It's something that we're barely learning about. And when you go to your regular doctor and you get checked for diabetes or pre-diabetes, we're just checking to see what your glucose level is. Well, in this state, which is now being coined a type 3 diabetes, your glucose is normal. So your doctor cannot diagnose it as easily, but your body's working overtime, overdrive, and all of those little changes cause a lot of inflammation that predispose to chronic condition development. Globally, excess body weight contributes to 4 to 8% of all cancers. When I read these numbers, that was shocking to me. Here we are thinking globally we have a undernourishment problem, yet our overnourishment is contributing to the almost 10% of all cancers. And in women specifically, it contributes to 15% of all cancer-related deaths. Again, shocking news to me. I'm very familiar with what that information looks like, what the data looks like for breast cancer, but just to make it a little bit more general and applicable to everyone here today, we also included some other commonly diagnosed cancers. For breast cancer specifically, postmenopausal obesity, an increase of excess weight translated into BMI, which is a ratio of your overall weight and height, 5% or 5 points above what's considered normal, translates to an increased risk of future breast cancer development by 12 to 20%. Also, for patients diagnosed with obesity, it is also increased risk for after patients diagnosed with breast cancer who are overweight have a 5 to 10% increased risk of mortality. For endometrial cancer, that percent of increased risk of cancer development because of that at least 5-point increase is 50 to 60%. I did not know that before this lecture, so presenting you information that to me was astonishing. Same thing with colon cancer development. The risk of developing cancer also goes higher with that 5 increase number of BMI points, which is a little bit higher in men. That 30% increased risk for men is because men and women store fatty tissue in slightly different ways. Men tend to store a little bit more of that excess weight in the belly area, inside the abdomen, so surrounding the organs. As women have a little bit more protection, we tend to accumulate a little bit more padding all throughout. That type of excess body weight deposit is a little bit less toxic than the excess fatty cells that accumulate around your organs. So that's why for colon cancer specifically, we see that same increase in BMI points translates into a higher risk of developing breast cancer. Or colon cancer, sorry. So again, we're gonna start our discussion of a lot of clinical trials, and I'll keep it simple and easy and to the point. Here we have a depiction of what little fat cells look like and how this paper from 2020 was one of the first groundbreaking papers explaining how obesity is contributing to breast cancer development. And from that, we've also done research in all the other oncologic conditions as well. But from this paper, what we learned is as fat cells start accumulating more and more fat, which you can see the yellow part here in the slides, they eventually get to the point where they can no longer store fat and they die. They get so large that the next step to them is dying. When those fatty cells die, they cause a small local reaction of inflammation that starts attracting inflammatory cells. Here we have the little star-shaped cell. That's one of the key inflammatory cells that help clean up the body. But what those little cells start doing, they start protecting those dead fat cells, and they start creating, let me see, can I use a pointer here? These little crown-like structures to try to seclude those dead fat cells and all the toxins. But in doing so, they start generating microenvironments of inflammation. With those tiny microenvironments, because they're trying to bring more cells to encapsulate all those dead fat cells, those inflammatory markers are what are driving the different types of obesity-related cancers. Specifically for breast, all those, which I have here on the side, changes in normal metabolic hormones that control your hunger, your energy expenditure, how we deposit fat in the body, whether or not it's around the organs or just underneath the skin. All those get deranged when we have these inflammatory states. So this was groundbreaking, getting to know more understanding of, okay, well, yeah, we see the association between weight, but from a cellular standpoint, why are we seeing that? What else do we know about weight-related changes and their contribution to cancer development or overall outcomes? So in a paper from 2019, we looked at the association between dietary patterns, basically comparing our normal Western diet, which is primarily driven by hyper-processed foods, high sugar contents, and compared to what we call a prudent regular diet, which is what other countries use, not what we do. There was a much higher risk of developing breast cancer with the current diet that we deem the Western diet. Then what about weight? What can we use weight or any of its permutations to determine whether or not patients are going to do well or not after a cancer diagnosis? So this is a paper from actually this year from China that looked at all the different parameters related to weight, height, actual weight number, BMI points. And the one area where they found very strong indication to be a predictor of worse outcomes is something called the visceral to subcutaneous adiposity ratio, meaning how much fat we're storing, and this is for women because primarily breast cancer, how much fat tissue we're storing inside our belly to how much fat tissue we're storing underneath the skin, that's a subcutaneous tissue. For patients that have a higher ratio distribution, they tend to have a lot worse outcomes. The recurrence rates are a lot higher and their overall response to treatment is lower. So this has been one of the first papers to identify how specific weight changes can contribute to those already observed worse outcomes in oncology care. And lastly, this is a slightly older paper here, also from China. They're a little bit more in tune with the holistic approach and maintaining overall health as prevention rather than treating disease. This was a paper that over 14 years enrolled women who were 50 or older with a diagnosis of breast cancer. And they compared their weight at time of diagnosis to their weight when they were 18 to 20. And what they found was for women who had gained 5 kilograms or more from when they were 18 to when they were diagnosed with a breast cancer, the increase in future breast cancer development was 2% for every kilogram of that initial 5 kilogram weight gain. So when you start thinking, well, I was reading this, I asked my husband, how much did you weigh when you were in high school? I think everyone I know has gained a few pounds here and there. And this is how it's translating. And again, it's that chronic inflammatory process that starts in an earlier age. Something that I treat a lot and it's becoming more and more frequent, which is very sad, is treating breast cancer patients in their 20s. My youngest current patient with metastatic breast cancer is 24. That is something that we used to see maybe once a year, and it was always linked to a genetic predisposition, some genetic abnormality contributing to why these young patients were developing breast cancer. Well, I can tell you none of my patients diagnosed this year alone have had a genetic predisposition. So it's because we're getting to a higher weight earlier in life. Our childhood obesity rates are higher. So we're exposing our children, we're exposing ourselves, our young adults to those chronic inflammatory states at a much earlier age now. So I just told you a lot of research of how weight can increase your future chance of developing breast cancer and other cancers, but is it too late? Can we do something to reduce that risk? Can we revert some of that weight gain and perhaps gain some protection? And the answer is yes. There was an Iowa study looking at more than 34,000 women, and they noticed that moderate weight loss, meaning 5% of excess body weight, so not a whole lot, just 5% of those extra pounds that we have, reduce their future risk of breast cancer occurrence by 25 to 40%. 25 to 40% risk reduction is as much as some of the medications that we offer for breast cancer risk reduction. 5% of excess body weight loss can confer almost as much benefit as medication. For people that went on and lost more than that 5%, closer to 10%, the gain of risk reduction was much higher, 50%. So yes, it's not too late. Modest weight loss can still revert some of those changes and confer some protection. And what about dietary habits? We've been exposed to the same diet for decades. Can we change those dietary changes? How can those day-to-day selections of food and nutrients affect our future development? Or if we are unfortunate enough to develop a cancer diagnosis, how can that impact our overall treatment portfolio and overall survival? So individuals with a healthy, withstanding the healthiest diet, meaning they include all the colors in the rainbow in their meals. Most days of the week, they have modulation of calories. They have 11 to 24% lower risk of cancer death. For cancer survivors, if they're following a healthier plan than what they were following from when they were diagnosed, meaning eliminating those high fat content diets, hyper processed foods, then they have a 10 to 12% risk reduction of dying from cancer or other diseases. So what's the takeaway from having a balanced nutrition and weight management or optimization of weight? So optimal nutrition and weight management are the foundation of integrative oncology. Maintaining and restoring that metabolic balance through adequate nutrition, weight optimization, regular exercise, all of those are things that improve quality of life. They reduce risk of recurrence and overall enhance survival. Early dietary engagement, especially for our oncology patients, and multidisciplinary coordination are essential to sustain these plans. Now, moving on to our next topic of integrative medicine. Yes.
You know how they tout red wine is healthy for you, but where does wine and alcohol fall into all of that?
Yes, excellent question, and I have unfortunately not great news about it. The type of why red wine was deemed a health food or a health benefit came from studies looking at the grape skin. They contain a metabolite called resveratrol, which in clinical trials and in laboratories, yes, it is. It enhances immune response. It enhances the body's ability to attack, identify, and prevent cancer evolution. However, once we make it into wine, and it's mixed with other things, including the alcohol and the sugars, those effects of the resveratrol, which were seen in isolation in an artificial environment, are mitigated. And instead, we're stuck with the bad side effects of just the alcohol or the sugar content. So now things that fortunately have to share with my patients is even one alcoholic beverage consumption is slight elevation of future cancer development, but it's a moderate, intelligent decision-making on what risk we're gonna take, just like when driving. Every time we get in a car, we know there's a certain risk of getting into an accident, potentially die, but we take those risks every single day. I'm not telling you to completely eliminate wine. If that's something that you enjoy, just know that maybe just limit it to moderation, but great question, thank you. So acupuncture, who is familiar with acupuncture? Have any of you experienced it personally?
Yes.
My dog has,
Yes,
Yeah.
a lot of,
and it helps.
believe it or not, but a lot of the data that we started accumulating came from animal studies, specifically dogs, and how we start extrapolating a lot of those health benefits to get a little bit more acceptance in the medical communities. This is something that is ancient. It's been probably longer than our allopathic medicine. So it is the therapeutic technique noted, especially by the Chinese, in which the insertion of very fine sterile needles into specific body parts trigger physiologic responses to promote healing. And it takes a special individual to go through with this treatment. If you ask me specifically, yes, I am a surgeon, but I'm personally terrified of needles. I can use them and someone else, but if I don't think I myself would find any relaxation in going through this. But I am bringing you data. I don't want you to use my personal experience or fears as an indicator of whether or not it's something that's beneficial. So how does acupuncture work? Well, the insertion of these tiny, tiny needles, which I've been told are as fine as hair, I'll believe it, but I won't test it myself, can activate very small nerve fibers that lead to the activation of spinal cord, midbrain, and the hypothalamus that result in the release of endorphins, dopamine, norepinephrine, other neuromodulators to regulate our own perception of pain and enhance the mood. It also triggers the autonomic nervous system, and it helps us balance our body by regulating heart rate, blood pressure, and our stress response. It also has some anti-inflammatory effects by increasing some of those cytokines that I showed you next to those little fat cells that were dying. Well, acupuncture has the ability to downregulate those inflammatory markers that are circulating in our body. And it can also trigger changes in our own endocrine system and regulate our hormonal imbalances naturally without the supplementation of hormones, without the supplementation of medications. So in a field like oncology, we're already bombarding you with medications, chemotherapy, radiation therapy, surgery. This is why a lot of our patients are very keen and open to the idea of trialing things like acupuncture because they're a little bit more natural and they're giving them relief for some of the treatments of their oncologic care. And again, back to boring slides. What does the science tell us about this? So hot flashes is not just something that women going through menopause experience. Unfortunately, hot flashes is one of the predominant side effects that breast cancer patients experience because of the treatment that we're giving them. Since the majority of breast cancers are driven by hormone, excess hormones, and the hormones are keeping and the cancer cells thriving and proliferating. Part of the treatment includes suppressing the body's ability to create more hormones, even for patients who have undergone menopause or people who have had their ovaries surgically removed. Our bodies still have the ability of creating a small amount of those circulating female hormones, estrogen, progesterone. And again, back to, and I'll keep everything that we talk about, I'll keep referencing back our little fatty cells. After menopause or when those ovaries are surgically removed, our fatty cells take over the production of those female hormones. So part of the treatment at all stages, all ages of breast cancer diagnosis is reducing those circulating hormones to reduce the chances of something coming back or progressing in disease. So yes, hot flashes are very debilitating. Everyone experiences hot flashes slightly different. I have patients that unfortunately have started going through menopause, then they have a cancer diagnosis, and that period of hot flashes and perimenopausal symptoms just gets prolonged for decades now. And that is affecting your quality of life. That is not something that we want you to get out of this treatment. Yes, we're great at treating your cancer, but at what cost? The main goal of treating cancer is not just getting rid of that disease, but allowing you to restore your health so you can enjoy the residual years of life that you have. So that's why I chose this paper to share with you. This was a study from 2023 where actually from the Dana-Farber Institute in Massachusetts, where 150 women underwent acupuncture treatment, and they were given quality of life questionnaires before starting acupuncture. After each session, they went through different variations of body parts treated, duration of treatments, and every single one of them by over 50% experienced overall quality of life improvement, with the reduction of the frequency of hot flashes as well as the intensity of them. So that to me was a win. And this is not taking it from our very expert, the Chinese. They tend to adopt these measures a little bit faster than we are. This is for American patients here not too long ago. And then very exciting in 2022, ASCO, which is the American Society of Cancer Organization gave us additional recommendations for cancer providers to follow on how to implement these alternative or complementary therapies. And what they did is they reviewed at least 3 decades of clinical trials and publications looking at all sorts of complementary therapies to see if the risk of pursuing those benefited or outweighed the potential complications of the therapy. And they actually now make recommendations for all patients undergoing aromatase inhibitor treatment, which is that medicine that we use for hormone positive breast cancers, to be offered acupuncture for one. Another side effects aside of hot flashes is arthralgia, specifically of the hands. We are human and we're very tactile beings. The utilization of our hands is part of who we are. And for a lot of these patients, not only are they experiencing the hot flashes, they get very debilitating arthralgias where we prematurely experience that arthritic change of the hand and maybe lose some of that function. Whereas acupuncture has been shown to positively reverse some of those side effects while undergoing treatment. Also, it's recommended for patients experiencing pain and other side effects like nausea. So these are guidelines to all providers caring for all sorts of oncology diagnoses. And again, not too long ago, 2022, have all providers adopted these? We're not there yet, but we'll get there. Usually it takes about a decade before recommendations actually make it into a clinical practice. We're making waves. And then lastly, how can acupuncture help mitigate some of the other side effects associated with cancer care, like nausea? So this was a trial from 2017 looking at acupuncture and acupressure specifically, and it looked at 12 different clinical trials just to pull data. Part of why proving that these therapies are effective is because most trials are very small. So by collecting 12 different randomized clinical trials, they pulled over 1,400 patients. And with this, that gave a little bit more validity to the studies, but they did prove that it has a protective effect against the nausea from chemotherapy, which for a lot of patients, that's huge, because once you're undergoing treatment, well, most of the medicine that we give you to treat nausea are pills. So when you get to that state where even water, the idea of water is giving you a visceral reaction, well, if we can avoid giving you anything else that may be stimulating of that nausea, then our patients are more than happy to try that. And then one very last one I have for you, again, bringing it back to obesity. Can acupuncture help with weight loss? Weight gain is easy, weight loss is hard. If it was easy, we wouldn't be having this discussion and we will all be in perfect weight. Well, this was a study from 2017, again, credit it to our Chinese friends. They compared acupuncture to other sham interventions, and over a span of 12 randomized clinical trials, it outperformed, acupuncture itself outperformed the development of, or the weight loss experienced by patients undergoing acupuncture was 10 times higher than those undergoing sham treatments or placebo treatments. What are our takeaways about acupuncture? Well, acupuncture is evidence-based. It's low risk. Yes, there is the risk of localized discomfort or pain, very minimal risk of infection. It is a physiologic therapy that effectively relieves pain, fatigue, hot flashes, and other symptoms related to cancer care. It acts on our neuroendocrine and immune response, and it helps our own body's ability to respond to treatment. and is now, as of 2022, supported by the biggest body in oncology guidelines. Now, behavioral health. Who here believes that our mental state can have the ability of protecting us or hurting us when it comes to developing chronic conditions? I'm very glad. The majority of my colleagues don't. So this is a newer area that we're bringing a lot more focus and emphasizing and proving why we need to embrace that holistic approach of care, not just in oncology, but in everything that we do in medicine. And some sad statistics to share with y'all. The prevalence of depression among cancer survivors is about 33%, meaning 1 in 3 cancer survivors of all cancers is depressed. According to the CDC, 3 out of 4 people with a cancer diagnosis experience some sort of psychosocial distress. That means depression, anxiety, post-traumatic stress disorder, 3 in 4. The NCI also noticed 25% of cancer patients have clinical meaningful depression, meaning it's debilitating enough to affect their day-to-day. But it's not something that affects only cancer patients. It also affects our caregivers. Of our caregivers, 42% of them report depression at some point while caring for someone with a cancer diagnosis, and 46% of them an anxiety distress score. One of the most meaningful encounters I've had with a patient, she was doing fantastic, young patient, single mom, had a 5-year-old girl. She was going through her chemotherapy, having a phenomenal response. We were very happy for her. And I visited her while getting, I believe it was her very last infusion. So we were getting ready for the next step, which was going to be surgery. And she was there with her mother. She grabbed my hand and started crying. And at that moment, I thought those were happy tears because we had reached the culmination of her treatment and there was light. We were ready to move on. And she said, "I need your help. I don't know how to help my daughter." I went, "What do you mean? What's going on with your daughter?" Like, "Well, she's 6 years old and she doesn't understand what's happening to me. I'm changing. I've lost my hair. My appearance is changing. And her behavior is changing. And now she's suffering at school. She's getting bullied." I never before that encounter had a patient explain to me how their own oncologic diagnosis affected their family. And at that point, that was also in the process of us choosing what therapies we needed to include in integrative medicine. I saw firsthand why emotional health, not just for patients, but for their loved ones and family members, should be included in this program. So luckily for this patient, we were able to work with a behavioral therapist who specializes in child needs to explain the diagnosis. And for her, the way she was acting was from a lack of understanding. You're 6 years old. We don't expect you to understand what's happening. But having someone with this specialized training to explain it can make a world of difference on what your take to those changes to your loved one is. Again, back to the first question I asked before we started this slightly more morbid topic in integrative medicine. But it is no secret that emotional distress, that being depression, stress, whatever, is known to have negative effects on overall health, and it can promote the development of chronic conditions, including obesity, diabetes, immune-related problems, cancer, whatnot. Stress specifically is known to have effects in the heart. It increases the risk of cardiovascular related mortality. It also increases risk of myocardial infarctions by 2 to 3 times. Overall distress is linked to earlier onset of age-related diseases, and increase, which to me, that's why it's here in orange, all-cause mortality by 45 to 55%. Again, our medicines that we use, and going back to breast cancer, which is something that I'm very familiar with, or our patients that we give those hormone blocking medications, the number that we quote them on risk reduction of a future cancer development is 50%. Whereas here we're seeing 45 to 55% risk of all-cause mortality, not just in oncology, but across all different chronic conditions. Then we have been neglecting prioritizing overall mental well-being. This is a very busy slide that I will not attempt to go through in detail because I am not a behavioral health specialist and I would be speaking out of term if I try to explain it. But there's different types of therapies that can be implemented to help us with emotional stress, emotional well-being. The most widely accepted one is the first one listed, cognitive behavioral therapy, where the core principle of it is to identify and reframe the maladaptive responses that we generate over time through behaviors and pattern. It helps by reducing cortisol levels. It improves our coping skills, and overall it reduces anxiety, depression, fatigue, insomnia. This is one of the therapies with the most benefits seen in oncology patients. For the other ones, yes, we do see some benefit in overall health, but specifically in oncology, that's why we tend to push a little bit more in this cognitive behavioral therapy. And I'm more than happy to share the slides if we want to share them later.
We'll share them.
Okay. And again, back to the boring slides, but I'm a science person. I need to know what the evidence is behind all these things before I start recommending them. This is a older trial. This paved the way in breast cancer care to bring attention to the priority of overall stress and coping skills. This is a study from 2003. Out of the Netherlands. It looked at whether or not stressful events increase the future risk of breast cancer development. Because anecdotally, I can tell you, the majority of my patients come in and say, yep, in the last 2 years, something very stressful happened in my life. I lost a loved one. I went through a divorce. We had financial troubles. Everyone can pinpoint something in about the last 2 years leading to a cancer diagnosis. But again, that's something that most people treating oncology patients can anecdotally say, but we did some trials. We haven't replicated these trials in the United States, but out of the Netherlands, they did find that for women undergoing a major life stressor, and by major, something like the loss of a loved one or a spouse, the increased risk of future breast cancer development was 1.37 higher than anything else. And by major, I mean something significant enough, not work-related things. Those smaller stressors in life did not have any statistical significant increased risk. But this was one of the first papers showing how stress and our coping skills can affect our development of cancers. And what about interventions? So we all live with stress. It's part of human nature, but can we introduce therapies like that very long chart that I shared with y'all to reduce or mitigate some of those risks? And this is a newer paper now from 2024, looking at psychosocial interventions that significantly improve quality of life. And again, that's something that I emphasize a lot because we have gotten very good at treating cancer patients, and we expect them to be around for a long time after their cancer diagnosis. So we want to make sure that that quality of life after a cancer diagnosis is maintained. And they did see also prolongation in overall survival and disease-free survival after a cancer diagnosis. And again, the specific intervention here was first one that I showed in the table, the cognitive behavioral therapy. And again, another one on survival, because I'm big on survival. This is a little bit an older study from 2014. This looked at 13 different randomized clinical trials, and it looked at overall at 1 year and at 2 years, the survival benefit in patients undergoing cognitive behavioral therapy through their oncologic care was doubled as opposed to no therapy at all. However, this is not the best trial probably, because that was not observed after 4 years. So that benefit was only noticed early on after that oncologic diagnosis. But the takeaways of emotional well-being is that emotional distress is not merely a psychological condition, it's biologically. It affects all our systems. It can accelerate aging. It can dysregulate our immune system. It increases our risk of cardiovascular conditions, metabolic conditions, and it can even shorten our life expectancy. Addressing it is a cornerstone of preventing disease and why it's also part of a cornerstone for integrative medicine. Now, something a little bit more fun, touch therapies. I think everyone in this room might have had an experience with touch therapies. Who has had a massage? Most of y'all. And believe it or not, you are doing something good for your health with those touch therapies. Again, have a little bit more experience with touch therapies to give you a little bit more background on all the different types of techniques or specific permutations of therapy included in integrative medicine. Those of you who have had a massage, you know, it's different from person to person. They always ask you what kind of pressure you want, whether it's a relaxation purpose or muscular related. So there's different techniques, and all of these different approaches have a specific outcome in mind. And one that I'll end up explaining a little bit more is our lymphatic drainage, which is similar to a traditional massage, but it focuses on utilizing a little bit less pressure to reroute excess body fluid that accumulates in different body parts towards areas that may be able to better drain that excess fluid. When fluid accumulates in the body, it's because there's something wrong going in that specific part of the body. In breast cancer therapy specifically, everything that we do to treat that cancer can promote the development of lymphedema or excess accumulation of fluid. So this is one of the areas that we utilize a lot in integrative medicine. So again, what is lymphatic massage? This is the manual lymphatic drainage technique that uses very gentle pressure, and it's structured. It tends to start in the abdomen, and they call it waking up the lymphatic system by opening those little channels that help the body regulate that fluid accumulation. Very similar to, I'm sure everyone's experienced after a very long day of walking, a hot day. By the time you get back home or before going to bed, you notice your ankles are a little bit swollen. You get to bed the next morning, they're back to looking normal. That's just the excess accumulation of fluid, which was not helped by gravity because it's constantly pulling. So lymphatic drainage techniques aim at creating a opposite effect of that pulling and rerouting that excess fluid. And like I said, lymphedema is, yes.
Remember to repeat the question, where can you get a lymphatic massage?
Excellent question. That was, where can you get a lymphatic massage? So right now, I can advertise here through the UMC Cancer Center. That is one of the core services that we offer and that we're expanding for all oncology patients. The goal is down the line, once we have a more robust program, to make it available for all patients, not just oncology. Since it's still in its infancy, we're limiting to just oncology patients. But yes, this is something that is currently available at most cancer centers. Lymphedema, that chronic accumulation of excess fluid that happens very prominently to breast cancer patients, but overall globally affects all oncology patients, and about 15 to 25% of them, of survivors, experience it at one point or another. It, unfortunately, it is something that once it develops, it doesn't go away. There are things that we can do to mitigate its progression and treat the symptoms associated for it, but it's not something that you develop and we give you a pill and it goes away. So prevention is key, and early detection is the most important thing that we do. When dealing with breast cancer specifically, these are some of the risks for patients to, I don't know, what do I do here? I don't know that you're gonna be able to help me here. Our screen went to sleep. Oh, that's gracious. If you can help, I'll keep explaining this. And so everything that we do to treat breast cancer patients, like I mentioned earlier, can have some side effects, and lymphedema being one of them. Every element of breast cancer treatment can promote the development of lymphedema. It primarily affects the arms because of the location of those cancers. So when we're offering cancer surgery, any patient with an invasive breast cancer diagnosis, part of that surgery not only includes removing the breast tumor itself, but it also involves either sampling some of the lymph nodes underneath the armpit, because if a cancer is going to spread, 90% of the time it's going to spread to those lymph nodes first before it goes somewhere else in the body. So it gives us prognostic information. It gives additional information on what the treatment after surgery will look like, whether or not we find cancer cells in those lymph nodes. So the surgery alone is probably the first trigger of potentially developing breast cancer. And how much surgery we do to those lymph nodes also affects whether or not you develop breast cancer. So the more lymph nodes we remove, the higher the risk of developing breast cancer. So when I'm explaining to my patients what the risk of that specific surgery is, I explain it in, there's two flavors. I can only sample them or I can remove them all. Only patients who have bulky disease, people that have already disease in those lymph nodes from the get-go, get all the lymph nodes removed. People that we think they look normal, but we want to make sure, get those lymph nodes sampled. The risk of developing lymphedema after the surgery of only sampling, it's 2 to 5%. It's pretty low, single digits. Whereas for patients that require removal of all the lymph nodes, we're talking about 20 to 30% with the surgery only. That's a drastic change. So less surgery, less risk. Then what other therapies of breast cancer can further exacerbate that risk? Well, patients with breast cancer, a lot of the times we offer radiation therapy. Well, that can also trigger lymphedema formation. And for those patients that have all the lymph nodes removed because they have already a lot of disease in the lymph nodes before surgery, that also get radiation afterwards, it's no longer 20 to 30%. We're looking at 50%. So a lot of our breast cancer patients, unfortunately, live with the sequela of the treatment. Yep, the treatment is great. It got them through the cancer diagnosis, but now they're survivors and they're left with this debilitating condition that if you do nothing, it continues to get worse and worse and worse. Luckily, we are very aggressive. We know that breast cancer patients are at very high risk of developing this, so we started those interventions very early on. And again, another risk factor unrelated to cancer care is BMI, our weight. People with a higher weight at baseline have a higher propensity of developing lymphedema. So even with smaller interventions like just sampling lymph nodes, that 2 to 5% may be closer to 5 if we're in that overweight category.
And how did you say that usually presents, like in your arms?
Yes, so the majority of patients that develop lymphedema only get lymphedema of the arm itself. And that happens show you here. So when we do surgery, we sample little lymph nodes under the armpit. All these little green structures that you see here, those are tiny, very delicate, almost see-through channels. When you look at them during a surgery, actually, we need microscopes to actually see them. They're see-through. They're very, very fine. They're very delicate, that even if they're not damaged by surgery, the scar that forms from surgery can block them. So what ends up happening is all that fluid that is normally generated in the body, which is a normal process, has no way of returning to your circulation. So just accumulates in that arm and it starts swelling and swelling. So swelling is the first sign. Well, there's some other earlier signs that we'll discuss in a second.
Is
Oh,
this painful?
yeah. Is this right? Yeah, it looks. Thank you so much. Let me see. No. What is going on? I don't know. This one I didn't even touch and it misbehaved. That's probably why we don't use this one. Let's see. Oh, I think this looks more. But this 7 years. It should. Yeah, it does. Okay, yes, thank you so much. Back to your question, I'm so sorry.
Oh,
Did I
I said
answer?
that's painful.
It is painful. Depending on the degree of swelling that you develop, it can also increase risk of other cancers. Again, swelling, inflammation, and it increases your chances of infections because the skin thins out. It is more prone to breakage. And it's also, if something enters your circulation in that arm, it doesn't have the proper flow like the rest of the body to clear it from any microorganism that may enter. So a lot of potential bad side effects from developing lymphedema. So again, back to my boring slides, data-driven slides. Can massage therapies relieve some of that pain like you mentioned? And the answer is absolutely yes. Every single clinical trial that has looked at symptom management of all touch therapies when looking at pain have positively identified reduction by at least 50% in the majority of subjects, especially when comparing to no treatment at all. And I think we don't need the fancy clinical trials to understand that. Anyone who's been to massage, by the time you leave, you're a lot more relaxed and the overall body just feels great. And what about specifically looking at cancer patients? Well, this was actually a trial out of Memorial Sloan, which is one of the bigger institutes in New York where a lot of the evidence for oncologic care comes from. Also noted this was a rather large clinical trial looking at over 1,200 patients and whether or not the implementation of massage therapy and touch therapies could help ameliorate some of the side effects of chemotherapy. This trial specifically looked at patients undergoing care with bone transplant for hematologic conditions. So that is painful. And with massage therapy, there was almost a 90% reduction in the experience of discomfort. And one area where I was a little surprised was whether manual lymphatic drainage can reduce the risk of future lymphedema development in breast cancers, which to me didn't really make a lot of sense. I know the treatments that we do are causing a blockage. There's a structural problem why lymphedema develops. Yes, I can understand why doing therapies can help reroute some of that fluid to channels that are functional or keep that compression of an arm and prevent the fluid from building up in the first place. But what this trial looked at was early implementation of lymphatic drainage after oncology care can also reduce the chances of lymphedema development, which to me was absolutely incredible. So new policy, at least in my practice, is every patient, no matter how many lymph nodes we remove, whether it's 1 or 50, every single patient undergoes an occupational therapy assessment to make sure that we're recognizing the symptoms and the opportunity to intervene as early as possible. And takeaways from touch therapies, which are my favorite component, other than nutrition and weight management, these are massage, manual lymphatic drainage, and the other related modalities are supportive interventions. They're not tumor-directed treatments. They're not gonna extend life. They're not gonna treat actual oncology conditions. But they also, the goal of them is to relieve symptom burden. They enhance the recovery process. They restore body awareness, and they're overall safe, and help you reconnect with the mind-body connection. And what are some of the challenges and future of integrative medicine? Like I said, I did not know that integrative medicine was a concept up until 2.5 years ago. And it's very challenging to standardize these therapies. A lot of it is because we are unable to create, like when we're testing medications, we can create 2 pills that look the same. One has an active component or the medication that we're testing, and the other one can be a sugar pill. But when the subject takes it, they don't know what that, whether they're getting a dummy medicine or the actual medicine. So it's easy for us to test them and know, are we seeing effects just because the mind is telling us to see an effect or because it actually works? Well, if you're testing getting a massage versus not, the person not getting the massage knows that it's not getting a massage. So it's very challenging to create those clinical trials to actually test their efficacy. A lot of the trials are done with questionnaires, noticing subjects' change in overall experience. There's a lot of institutional and regulatory barriers, again, out of not being familiar with what these therapies are. Not all oncology programs supported. There's cultural and perceptual challenges. A lot of them, especially when we start talking about these alternative therapies or complementary therapies, there's a lot of negative connotation to it, thinking, oh no, well, you don't believe in medicine, you're just doing something instead of. No, that's not why we're bringing these therapies. They're not meant to replace traditional medicine. They're meant to experience and change that experience of traditional treatments. And again, there's a lot of research gaps. People in medicine who are very science driven. So if we can't really generate a lot of that good quality research to prove that it helps, then there tends to be a lot more pushback. Also, coverage. Right now, the majority of therapies covered under integrative medicine are not covered by insurance programs. Their lymphatic massage is something that is, but everything else is still very much cash pay. So there's a huge discrepancy on who is getting these treatments and who's getting the most benefit out of them. Hopefully that's something that changes in the future, because everyone deserves the ability to have access to complementary therapies. So what does the future bring us? So hopefully with the integration of genomic health, that's where we study your individual genetic makeup to see what medicines are best for you, what is your specific disease process. We can also incorporate a lot of these complementary therapies. Some of us are more prone to responding to some of these complementary therapies. I think no one will argue when you get offered a massage, but if you are offered acupuncture, you may have some restorations. Using that information to create a more personalized treatment plan, hopefully where we're headed to. we can start looking at the more trials we do, even if they're smaller, accumulating more data to allow us to make our decisions about how safe they are, integrating them, creating educational events, because again, all of this is something that I have been learning on my own. This was not, none of these treatments, none of these therapies were part of my medical school training or my undergraduate training. This is a newer area that now we're recognizing needs to be part of medicine, and we're lagging behind, but hopefully as we continue to evolve, the more we push for it, more places are adopting and creating integrative medicine programs or centers. And there's gonna be more regulation of that, more integration, and hopefully insurance companies will start adopting this and we can have more coverage of them. So hopefully a lot of good things coming our way. That's all I have for you today.
Cover your eyes.
Yeah.
That was a lot.
Welcome back. Yes, hi.
What is your own personal level of use or implementation of the acupuncture? I think of that as sort of an alternative. What's your view about the level of your own involvement at the moment?
Yes, like I said, I personally am terrified of needles, so I myself have never tried it. But that is something that we start offering to all our breast cancer patients as of 6 months ago. So I've gotten 6 months of amazing feedback, even more amazing feedback than any trial, any research that I've done. I've had patients come in saying, you know, I was having horrible hot flashes before this cancer diagnosis, then my hormones were taken away, and then you're giving me hormone blocking medication, so they got even worse. But I've been going through this perimenopause for 10 years, can't sleep through the night. A patient came and said, cried in my office saying, I slept through the night for the first time after my very first session of acupuncture. That is, to me, is very meaningful. And those are stories that I share with my other patients. It may not be for you, but you're not going to know if you don't try it. That is something, go in with an open mind. So yes, we do have a certified acupuncturist as part of our oncology program. So all our patients, and as a matter of fact, that is something that the hospital system covers for all breast cancer patients while we're building this program, because we want people to know what it is. We want people to experience it. So something that we are very proud to implement in our oncology care.
So it is available. I mean,
It is available, yes.
That's my next question, like where would you go to do it?
It is available at that new hospital, UMC Cancer Center, Health and Wellness on 114th and Slide. That's where all our acupuncturist service are offered. So it does exist. I'm not just making it up.
Well, that's what I'm curious about too. You may not want to recommend a provider,
Mhm.
but I'm assuming that there are some providers in town.
Yes.
I'm lucky enough not to have ever been diagnosed with cancer, so I wouldn't be a patient that way. But I do suffer from osteoarthritis, and you mentioned hands, you know, and the pain that you can feel in your hands from that. So I would be curious about that too. What would we need to look for in a provider? Are they licensed or?
Yes, and that's something that as the director of integrative medicine, yes. Oh, yes. Question is, what do we need to look for in a provider offering services for acupuncture, whether or not they're licensed, or what other qualifications to look for? And answer is yes, there are specific licensing programs for an acupuncturist to go through, and it's actually a very extensive program. It's not just knowing all the acupuncture places and what specific trigger points cause what symptoms or symptom relief, but also demonstrating proficiency and committing a number of hours and patient experiences before you are certified as an acupuncturist. To my knowledge, the only person who has gone through that entire certification process, which I believe took her around 5 years, was the acupuncturist that we've hired at Health and Wellness Hospital. She was not from the area. She was still in the process of completing that. So, well, yes, limited providers are available in the region. Just asking and knowing what their experience is, what training they've had, but if we're expanding beyond the region, yes, there are certifying programs.
So not being a cancer patient per se, I really wouldn't be able to use the one you're referring to.
So we do, you are, everyone's welcome. The free acupuncture is only reserved for breast cancer patients, but the services are available.
Texas Tech Health Sciences Center had an acupuncturist on staff for many years
Mhm.
in family practice, Dr. John.
Okay,
And she was there, you could make an appointment with her. I went to her, my mother went to her for years. And no, insurance didn't pay for it, but she was extremely affordable. It was throughout the family practice department.
yes,
And it
I
was excellent.
I don't believe she's still
No.
practicing, but I know when we were credentialing our acupuncturist, we went through the family medicine program because they had had that experience
Right.
before.
She's with TCU now.
Yeah.
But
We just need to grow the number of providers that we have, and that's part of what the future of integrative medicine is.
MD Anderson offers an integrative, I had a friend who
Mhm.
had breast cancer.
Yeah.
And it doesn't live in Lubbock, and they offer an integrative health program free to their cancer patients, they're huge.
Yes,
And she thrived with it.
and that's actually one plan that we're trying to emulate. The way that integrative medicine services are offered almost look like a little menu. Patients are given a menu-like booklet of all the different therapies that they have, and they can choose to sign up for all their complementary therapies, whichever one they feel that's gonna give them the most benefit. And that's, again, our program is very, very much in its infancy, but that's the one specific treatment that we've reviewed that seems to have the most user-friendly and accessibility.
But everything you said reminded me of what she told me that MD Anderson told her. Diet,
And
exercise.
I would love for that to be a complimentary service for every patient. We just need a lot of donors for that. Yes.
I can be a testimonial for the lymphedema and the massage therapy because I battled it for quite a long time, and that finally was absolutely miraculous.
Mhm. And you're not alone, like yourself, a lot of patients, yes, it's consistency, it's not an overnight change that you'll notice, but the more you do it, the more benefit you see, the better you feel about your overall health and gives you that strength to continue going through your treatments. Do you have any questions online?
I'm repeating questions.
Okay. Okay, well, I guess everyone's ready to enjoy the rest of this beautiful Friday. Well, before it gets a little on the cooler side that we don't enjoy so much, I personally prefer warmer fall. Thank you, everyone.
Thank you.
Now I'm trying to figure out how to send them to you.
I'm gonna just tell you guys this,
I can use.
someone online said, as a patient of Dr. Daniele's, her PA referred me to the acupuncturist at UMC Health and Wellness. After 5 treatments, I no longer experience hot flashes, I sleep much better, and my emotional state significantly is improved.
Oh, well, that just makes us very happy to hear. Thank you.
So when they're talking and I click something, that's what happened. And I was like,